All right, guys, it's Sunday night. It's Sunday night service. You've never been here for Sunday night service.
First time for Sunday
First
night
time.
service.
And guys, as you get logged on, hit your heart buttons, hit your like buttons, and we normally don't sit this close together. I think I'm popped up on here now, if you'll find it on there. All kinds of heck has broken loose on Facebook on my computer, so we're having to use my cell phone, and I can't see. We've set it up, and so anyway, it's a big old mess. But anyway, we have to sit right close together because my hair's so big and the little phone is so little. So anyway, am I on here? Do you see where it says Dani Williamson is live? Okay, guys, get on. Tell us where you're from. Maybe go to your Facebook. Yeah.
Let's find that.
Anyway, we got Dr. Ethan Kellum in the house tonight. Dr. Ethan Kellum is with Nashville Regenerative Orthopedics.
That's it.
I know exactly where he's from. But we literally haven't seen each other in forever.
It's been a few months.
It's been a long time. He just came basically straight from the airport from teaching in oh, there we are right there. From teaching in where have you been?
I was in Las Vegas.
In Las Vegas, okay. So we're going to talk about how to not need your orthopedic surgeon tonight.
Right.
How to put your orthopedic surgeon out of business who does not practice functional medicine like this guy does, which I'm excited. We're going to talk about stem cells and PRP and things like that.
All the good stuff. We're going to talk about all the good things.
Okay.
And don't tell my orthopedic surgeon colleagues that we're talking about this. This is our secret. Right here.
That's right. All right, guys. Again, once you get on here, hit your heart buttons and all. We're going to talk a little. Oh, wait, you don't know this, but it's Sunday night service.
Sunday night.
So we have a little communion Sunday night. All right, guys. If you have questions, post your questions down here. Now, I'll have to answer them, or he will later, because the phone is up here in front of us, and for some reason, you need to turn that on. Yeah, there you go. All right, guys. So get this. We're talking about musculoskeletal diseases tonight, arthritis, joint pain, all the things that happen. You know, as we're getting older, I'm getting older. I don't think he's aging whatsoever.
I'm getting older for sure.
But it's a greater burden every year on society. Pain is, right? And musculoskeletal problems. And back pain is the most common physical condition in which patients visit their doctor. And I believe that.
Number one.
Can you, right? So in any given year, between 12 and 14% of the United States population, adult population above 18, will visit their doctor or their nurse practitioner for complaints of back pain, which is interesting. In 2012, more than 52 million patients visited their provider with that complaint, compared to 44.6 million in 2004. So it's only going up.
It's only going up as the population is aging.
As the population is aging, it's a bigger burden. Low back pain is the most common. That affects 28.6% of the population. Knee pain came in a second, and you like knees, don't you?
I like knees, I like shoulders, I like it all, but those are the things that we handle the most of.
Okay, and that was 18.1. And then neck pain was the third most common at 15.2%. Okay, females report pain more frequently than men.
Yeah, so
we just had this conversation. I said, why do you think that is? I don't know. Is it hormones? What is it? And he said the perfect answer.
So women are more conscientious of what's going on with them versus us guys. And we're also, we're going to have a tendency to not say something when we're hurting or, and so women drive healthcare. We know that. And so that's why I think that is.
That's true. That's true. So you think we're more self-conscious of pain, and we're all, because when I get a man in the office and he sits on my couch just like this, and I sit across from him, I say, okay, why are you here? Every single time, 99.9% of the time, the men go, I don't know. My wife sent me. She says I needed to come in.
Exactly.
And I'm like, well, what's wrong with you? Nothing. I'm fine. Well, then they have this whole list of stinking problems by the time it's over with.
Right.
So, okay. So females report it more often. All right. Let's see here. Okay, so the prevalence of low back pain and neck pain is the highest among ages 45 to 64, and I believe that, while overall joint pain is the highest among people ages 65 and older. 7 in 10 report joint pain in that age. That's something. $253 billion in 2012, it was estimated. That's the direct medical costs for all back-related conditions, just back-related.
Just back. We haven't even started talking about shoulder or knees or anything else. We're talking just back.
Oh my gosh. So back pain, I mean, I don't know. A lot of times in what I do for a living, we never know what really originates, what tipped them over into something. Do you always have a reason for back pain? Do people, do they always know what happened? I heard it in football, or I heard it in yoga, or whatever.
Yeah, it's one of those things that can be very acute, right? And so
right.
Sometimes they know that, but sometimes it can be something that kind of can be brewing for years, right? They forgot about that car wreck, or they forgot about that injury in football, or when they're doing soccer or things like that. So sometimes it can be something that can be going for years, and because there's a continuum of disease, right? And so we only see you at the point of, hey, this hurts.
Yes, nobody comes in preventatively, do they?
Right, and that's one of the things that we would love to kind of get better at, at least what I would like to get better at, is doing that preventative so that they don't have that back pain or that knee pain down the road.
Okay, and we're going to talk about that and what you do. All right, guys, this guy, Dr. Ethan Kellum, if you don't know him, you need to look him up because he's fairly new to town. How long have you been here?
I've been, my practice has been open for a little over a year and a half.
Yeah, not long. And we're going to talk about him here in a second. Okay, we're going to talk a little bit about arthritis. So the estimated number of adults with doctor-diagnosed arthritis is 54.4 million people and projected to reach 78 million by 2040. Yeah. Doctor-diagnosed arthritis. And the estimated number of adults on average with arthritis attributable activity limitation. Crap, I don't even know what that is. AAAL, you know? Okay, 23.7 million, projected to reach 34.6 million by 2040. Arthritis. Yeah. Of course, itis means inflammation, people. Those of you that know me, he doesn't watch us all the time, but those of you that know me and know what I do, itis means inflammation, right? Arthritis, gastritis, colitis, sinusitis, Hashimoto's thyroiditis, vasculitis, what? Itis. What's inflaming you? Majority of the time, what is it?
Oh, as far as, it's going to be from your gut.
You bet. What goes down the pie hole, people? I'm telling you, it is. Many, many times. Yeah. You heal the gut, you do begin to heal. Many of these people right here, their inflammation, their arthritis would go down if they healed the gut.
And I have a very interesting story about that, just kind of anecdotal. When I was getting ready to set this practice up, I was playing basketball with my kids and felt like I was 60 years old as far as my joints. They hurt so bad, but I had been eating, I'm talking horrible.
Yes.
When I cleaned that up, my joints felt better.
Yes.
And of course, now I kind of have dived into the research of all that stuff, and I know a little more in why that is.
And that's something? Yeah. I'm telling you, it took 24 years of me seeing doctors with hand pain, joint pain, lupus, all these things before a doctor ever leaned into me and said, hey, Dani, what are you eating? Mm-hmm. Yeah. Do you know your diet controls your pain level? And that was true for me. Not everybody is at 100% their diet, like she's talking about bulging discs in her neck in here. And I mean, your diet will contribute to that, but I mean, you've got to fix the bulging disc as well. But it takes a lot of time, and I'm glad that you've realized this sooner rather than later with your patients. Yeah. Because I can't tell you how many orthopedic surgeons or gastroenterologists or what have you out there never associate the gut with pain or migraine headaches or what have you.
Mm-hmm. Yeah, very, very important.
It's a big deal. Okay, the top 10 most common orthopedic surgeries. And I asked him if this was true, and he says yes. ACL, reconstruction of the knee, right? Reconstruction of the knee. Knee replacement, shoulder replacement, hip replacement, and many of you probably know all about this. A knee scope, shoulder scope, ankle repairs, spinal surgeries, joint fusion, and trigger fingers. Do you do trigger fingers?
We do treat trigger fingers.
Really?
Yeah.
Okay. All right, so Dr. Kellum, now that you guys are logged on, now you're going to show him some love over here. All right, he owns Nashville Regenerative Orthopedics, and it's just right over here on Cool Springs Boulevard. We're going to put your address and your phone number up and your website. But the beauty of him is he blends interventional and regenerative orthopedics, and I love that. And I want to know how you got started in that when we finish this here. He's a sports medicine fellowship trained orthopedic surgeon. Right? Went to University of Tennessee for med school. Georgia, was it University of Georgia or was it? Augusta, okay. For fellowship, for residency. And your fellowship was up in Boston, correct? And then this guy was one of the surgeons for the Boston Celtics, one of the orthopedic surgeons. Harvard athletes and Tufts as well. I learned that today when I was looking on the website.
Yeah.
Right?
A lot of fun.
And then, his passion, it says on his website, right, is regenerative medicine, stem cells, platelet-rich plasma, as well as helping your patients become whole, right? Emotionally, physically, the whole thing, whole body health here, right? Yeah. Hopefully keeping it all together, blending it all.
Very important.
Oh my goodness, I'm so excited. Okay, well, tell us about it. I'm thrilled to death. Tell us what you're doing over there, why you're doing it. How did you at such a young age, because you're young, to be having branched out into this?
Yeah, so I'm 42.
That's young. Trust me, that's young.
And anyway, so I was kind of like most folks. I went to medical school, and at that time I was like, I think I'm going to be a pediatrician.
Pediatrician? Oh, you would have been a great pediatrician.
Love kids.
What?
Deal with the parents, but I didn't like the medicine of pediatrics.
Pediatrician.
Yeah.
I wouldn't deal with parents like you. I would love the babies all day, but it's scary. As a mom, I know. Yeah. I was right on top of that doctor.
Yeah. And so found orthopedics because I like to work with my hands, and so enjoyed that. And then went and did orthopedic surgery residency, and then figured out about sports and loved the athletes and weekend warriors and things like that, and just making those guys better. So did that, but it was during the fellowship that I started to learn about these very new technology. So stem cells, PRP. I was at a very busy fellowship, very busy surgeons.
Up in Boston.
Okay. But they were trying to find ways to keep people out of the operating room.
Wow.
And so that's where I first learned about those things. And then it was one of my very first patients when I was out of fellowship. You're on your own, and you're looking around and you're like, can someone help me take care of this person? He'd seen two other orthopedic surgeons in town. I was the third person he came to. He was a runner. You know how runners are. They're serious people. Like
very serious.
They're gonna run.
If you're a runner, hit your heart button out there, because you guys are serious about your running.
Serious about your running. So he came to me. He had Achilles tendonitis, had been treated in a boot for two go-rounds, had done all the therapy, still hurting, still having problems, still couldn't run. And so he came to me and he said, what can you do for me? And I said, well, you've tried everything out there as far as conventional that we have.
Okay.
But here's this one thing that you haven't tried, which is platelet-rich plasma. And I said, we'll give this a go. Anyway, treated him with that. 12 weeks later, he's back to running marathons. And so that was my first glimpse of like, hey, this is something that can really help. Otherwise, that guy would have been given, he would have gone to see someone and like, just quit running. And you can't really tell runners that.
No, you can't.
And so that was the thing that started all of this for me. And so, and then I wanted to know as much as I could about it. So just researching those things and finding out. And there's a ton of science out there, and it's mounting daily. But it really helps folks.
Yeah. So what is PRP, platelet-rich plasma? What is it? So, okay, tell me who you see in your office.
Yeah.
So who comes to see you over there?
Yeah.
Right? And when would you recommend this? Mm-hmm. Okay, talk to me about that. How would you do this before surgery, or how does it work?
So we'll back up. We'll talk real quick about what regenerative medicine is.
What is it?
So you've got the two main categories that you have. You have stem cells on one side, and then you have what we call growth factors on the other.
Okay.
So stem cells are naive cells that haven't changed into anything just yet. So
would you say naive cells? Naive, that haven't changed into anything.
So they can become
babies.
Yeah. So they can become cells. They can help with decreasing inflammation. They can help with healing. And normally they come about when there's an injury or something like that in the body. And so they get activated and they go to that place and they help do the healing.
Okay.
Now, the very interesting thing about tendons, ligaments, and joints is that they don't have a ready blood supply. So when they have an injury, that doesn't happen. Those cells can't get there. Because you go, well, why
Tendons, ligaments, and joints.
Ligaments, joints.
They don't have an active blood supply.
Mm-hmm.
Okay.
And so in effect, what we do when we take the stem cells of the PRP is that we bring blood to the situation.
Okay.
And so stem cells are definitely the most powerful regenerative medicine tool that we have. You can get them from a couple of different places. You can get them from bone marrow. You can get them from adipose. We predominantly use bone marrow at our
Adipose is fat.
It's fat cells.
Okay.
Right, yeah. And
you have to dumb it down for me, dude.
No,
you know, because
I'm
I don't say adipose all the time anymore.
Well, I'm an orthopod. We keep it at that level, you know.
Oh, stop. I don't believe that for a second. Okay, so you get it from me. If I was having knee pain and you were going to put PRP in my knee, where do the stem cells come from? Do they come from me?
They come from you. There's definitely there are other places, but mostly they come from you. We call autologous, but that means from you.
From me, okay.
And so we would get stem cells from your bone marrow. Platelet-Rich Plasma, or PRP, comes from your blood.
Okay. Well, I had a PRP facial just recently. Did you see that?
I did.
They took the IV, they took the blood out of here, spun it down, did whatever they did, and then put it back in my face.
That's essentially what we do in the knee or the shoulder. We do that very same thing, but we definitely kind of look at it. We get different concentrations and things like that because the knee and shoulders are a little bit different than the face. So you need a little more powerful.
I don't know. I could use a little more powerful right here.
I'm
starting to look like Harlan over here, guys.
I think you're doing pretty good.
Okay, so you take it out in the office.
Mm-hmm. And most people can kind of they're a little fearful of that at first, but that's a very easy process, very tolerable. People do very well.
Yeah.
We normally numb things up really good, give some medication just to make things super easy for them. So it's a good process. But yeah, so you have stem cells on one side.
Stem cells, okay.
And then you have growth factors on the other.
Growth factors.
And growth factors you can get from places like platelet-rich plasma, PRP.
Okay.
Amniotic tissue, placental tissue. And there's been lots of things in the news talking about, well, what about amniotic tissue and what about placental tissue? And it doesn't come from the baby, it doesn't come from the mom, it comes from the leftover tissues from kind of the afterbirth.
Like the placenta.
Placenta.
So it comes from the placenta.
Yeah. And essentially those are growth factors, and growth factors help with, once again, healing,
really
decreasing inflammation, and that's essentially what you had on your face was growth factors to help that skin do what it was made to do better.
Huh. Okay. So you can use stem cells, or you can use PRP, and they're two totally different things.
So yeah, totally different things. Like I said, PRP and those things, growth factors. Stem cells are the naive cells that haven't become anything yet, and they both kind of help do the same things, but stem cells are definitely more powerful than just growth factors.
So when would you use one over the other?
Well, it kind of depends. Sometimes if I'm doing soft tissue injuries, so someone has like a rotator cuff partial tear, or like a golfer's elbow or tennis elbow, or something like that, I'll use a growth factor like platelet-rich plasma.
Okay.
Versus if I'm dealing with arthritis in the joint, that's when I'm going to use stem cells. And quite honestly, when I combine those two, people do way better.
So you can combine them. You
Yes.
can do both.
Yep.
Okay. And you can put them in the knees, the shoulders, the elbows, the neck. Can you use the neck? Can you put them in a neck?
You can do neck, low back, muscle, ligaments, tendons, joints of any kind. Anything that you would go see your orthopedic surgeon for.
Right.
You could potentially treat with stem cells and PRP.
Really?
Yep.
Okay. So we'll keep talking about it because I don't know. I mean, we need to talk about insurance and cost and things like that, and how long it takes. Mm-hmm. Do you have to go to multiple treatments? I mean,
so so we'll talk a little bit about insurance. So insurance doesn't cover it. This is out of pocket.
Well, it works beautifully, so
right.
I wouldn't expect insurance to cover it. Sorry, but I'm a little cynical there.
Right. So,
they like to pay for sick care, not health care. That's what I've discovered in my practice.
Exactly.
So the procedure's not covered.
Procedure not. So coming to see us in the office, we take your insurance and those.
You
things.
do take insurance.
So we take your insurance to get X-rays, MRIs, to see you, to have a consultation for those things. But
Okay.
as far as if we go down that road of having a procedure, that's not covered by insurance.
Okay, but if you operate in the hospital, or if you are you
surgery.
still doing
Yeah,
surgery?
So I still operate. I still do.
Okay, and that you file insurance on.
Correct.
Okay.
Correct.
Okay, so you're not totally cash pay. You're kind of a hybrid.
Right.
Okay. Okay. All right. So, do we know anything about cost? Because I know people are going to put up there, and I'm sure. I mean, is there any sort of range?
Yes. So the range, platelet-rich plasma is going to be in the range anywhere from $800 to $1,500, and then stem cells are going to be in the range of $4,000 to $8,000, depending on what you have going, what you're being treated for, and also where you go to be treated for it.
So people generally start with PRP, I would think.
Sometimes
no?
It just kind of depends. PRP is a great treatment. It definitely helps, and we have lots of research on there. But like I was saying earlier, stem cells are king, and if you really want to try to get after something, like you might as well have the big guns with it. But it depends. Depends on what's going on.
I mean, could stem cells save you from a knee replacement, or no? Or is that
it definitely can. There's potential there.
Okay.
Knee replacements are very good surgeries. Probably 7 out of 10 people do very well with knee replacements. 3 out of 10 will have those things like MI and blood clots.
Oh,
and
good Lord.
Things that still hurt them.
Okay.
But stem cells can definitely buy you some time. I always tell people it's about 3 years as far as the average of having pain relief.
Okay.
But that means that some
Stem
people are
cells
longer.
last about 3 years.
Mhm.
Okay.
Not
okay.
sure.
Okay.
But folks can do really well with it. And especially, and there's sometimes that folks are like, I don't care what you're telling me, I'm not going to have a total joint. It's something that can help with that.
Okay.
With that.
Okay.
And help you.
What if somebody has a knee replacement and they're not doing so well afterwards?
Yes.
Would you ever go in there and do stem cells or
Like
anything in there?
inside
or
the joint?
Yeah.
Potentially around it. It becomes really tough to inject inside a joint that has a replacement because the risk of infection and those things. I've
Okay.
definitely contemplated that, but that would be tough.
Okay.
But I
All
have
right.
a lot of people that come in, they've had one on one side, and they're like, I'm not doing it on the other.
Are you serious?
Yeah.
Really?
And so it's those folks that, and it's very easy to, because they've been down that road once,
Mm-hmm.
right? So they know what it's like to have that total joint. And sometimes it goes great, and sometimes it doesn't. It can be tough.
Yeah. My dad had 2 knee replacements last year, and within 6 months of each other, and he's done really well, actually. He has. But, when you have a knee replacement or any sort of joint replacement or anything like that, one would need to change their diet as well to decrease the inflammation, right, in their body. And so I think it's a combination. But sometimes people do that, sometimes they don't.
Yeah, that's a huge thing. As like I said, we talked earlier about kind of anecdotally what I saw, but what I see with folks, if you can get rid of those things that cause inflammation, right here, the 7 things, right, soy, corn, wheat, peanuts, dairy, all those things.
Sugar.
Sugar's a big one. All the things that we like.
Yep.
That can help with your knee pain, with your shoulder pain, just inflammation in your body. If those things are gone, then your body obviously reacts differently, and you have a decrease in the things that cause pain.
Absolutely. Yeah. So the people who come to see you are your so what do you love? Let's talk about athletes and weekend warriors and all those things. I mean, what can people do to protect themselves? Other than, of course, eating an anti-inflammatory diet. But you see a lot of kids. Do you see children?
Yeah, so
how does that work?
So, kids around 13, 14, especially
Okay.
athletes. And, because kids will get tendonitis, they'll have, things like that. So we'll see anywhere from the junior high athlete to the professional athlete.
Okay.
And what's going on with them. Also, senior saints, right?
Yes, the senior saints. I like that.
The weekend warriors like myself, and then and also everyday normal people like myself too that that go to work and have issues with musculoskeletal problems. So all of those things, and like I said, there's not a lot. There's not always a surgery for what's going on with you, right? So,
Right.
tennis
goodness.
elbow or a a golfer's elbow, you've got a strain to your ACL, you've got, a meniscal tear, things like that. Not always a surgery out there for you to have. And so some of these things that we do can definitely help that.
Okay. All right. What else? Anything else? What do you want to talk about tonight?
Yeah, so we talked a little bit about nutrition.
Yes.
And I always the thing that I love to do is kind of look at the whole person and one really see what's happening with them. So as I've gotten older at 42 and realized that certain things don't work as well as it used to. So,
wait until you're 53.
Is that right? Is that right?
Jeez, oh Pete.
And so hormones and things play into that big, and having that balanced.
Yes.
Right.
Yes.
Which is something that you do extremely well.
I work on it. I don't know.
And so, for me as, trying to treat musculoskeletal pain, I just don't want to go, oh, well, gosh, we'll do this treatment for you and not think about anything else, because we're really doing you a disservice if we don't. So we really try to look at you as a whole person and look at that, hormone balance, diet.
Right.
How you're exercising, right? One of the things.
That's right.
One of the things that I notice with my professional athletes, especially my football guys, is that the sport beats them up, but the training to do that sport really hurts them. And so you'll meet some of the veterans, and they don't always do exactly what is kind of prescribed, because they've earned it a little bit. But that's why they're veterans. That's why they have that longevity, because they train a little bit different. I have a huge man crush on Tom Brady.
Oh, well, there you go. You get to watch him next Sunday.
Next Sunday.
This time next Sunday night, man. We're not having Sunday night service because nobody's going to be watching us next Sunday night. But yeah, we'll be watching him.
And so Tom is, he's 41. He's played this long because he has changed his diet. He's changed the right way he's trained. And so, if it's good enough for Tom, it's good enough for the rest of us.
That's exactly right.
And so you have longevity because you train well.
Okay.
And you eat well.
Yep. And you sleep well.
So
you move well, and you poop well, and you decrease stress.
Yeah.
I mean, these are all things that contribute to longevity, right?
Yeah,
and you have community. I mean, you got to have people, and he's probably got good people. I don't know, but yeah.
One of my guys that he introduced me to, it's called Headspace. When we're talking about
I have it. Well, it's on my phone that we're right there. Oh, you bet.
Yeah.
Do you introduce that to your patients?
Yeah. So I told them
you
about
bet.
that.
So do I. You guys who I've introduced you to about Headspace and Insight Timer.
So I haven't done.
So did Tom Brady tell you about Headspace?
No. So it was another NFLer that taught me about that one. But it's like he does it religiously every day, and I thought, well, if it's good enough for him, it's good enough. For me.
So Headspace. For those of you that don't know what Headspace is, I'm a big believer in deep breathing, in meditation, in just quiet breathing, just however you want to do it. You can do a walking meditation, laying meditation, whatever you want to do. But Headspace is one of those apps that's free, or you can pay for a bigger one. Insight Timer is excellent as well. Have you ever used that one? Oh my gosh, it's fantastic. And so I use those two together. And there's one now called Calm. And apparently Matthew Broderick has, because a patient just told me Thursday about this. She goes, I go to sleep to Matthew Broderick every night, Dani. I said, what? Not Matthew Broderick, Matthew McConaughey. There's a huge difference in Matthew McConaughey and Matthew Broderick. Broderick's fine, but McConaughey. Anyway, apparently he now does a reading on Calm, and he puts you to sleep.
Wow.
Woo-hoo! Yes. So anyway, I'm a big fan of Headspace. And so good for them that they do that.
Yeah. Very,
well,
very
you
important.
can't grunt yourself through that job for too many years. I mean, you've got to protect your body.
Yeah.
The professional athletes who go gluten-free, and I used to know all the statistics, but I've forgotten. I mean, like, I remember, what's the tennis player that went to the top?
Federer
is that it?
Yeah, he's one.
I think he's one that went gluten-free, and he went straight to the top. I mean, to the top. And as soon as you decrease that inflammation, and there's a lot of professional athletes who go gluten-free, but gluten's not the only booger out there. I mean, there's sugar and dairy and all of that. So, okay. All right, so you try to just address the whole thing. Now, I know in the office, so when you're talking to them, did you talk to them about all this?
Yeah.
I mean, how do you sleep at night? How do you, all these things?
We go through all those things.
Okay.
Because, especially if we get to the point of, hey, we're gonna decrease all this inflammation in our body, and hopefully we'll lose some weight. Sometimes they don't need my services, right? And that's really the goal. And so if we can get those things handled, then our joint pain may go away. What we're dealing with definitely helps. I'm reminded of a couple patients. One's a cardiologist that in his 70s, but he was a believer of that. And I think he got to the point in his 70s that he didn't need anything done because he had a very low inflammatory diet. And then he got to the point, like, okay, I'm hurting, and so we treated him regeneratively with stem cells, and that got him over the hump, and he's doing well.
Isn't that amazing?
Yeah, and so he, love to see.
In his 70s and a cardiologist, you know, if you have a cardiologist who talks to you about your diet and changing, the inflammatory foods and all that, you found somebody important, somebody good.
Yeah, and it's not only...
They don't usually believe in...
And it's not only also about what we, take out of our diet, but also what we put in our diet, right? So
you bet.
Turmeric, curcumin...
Oh my gosh.
Resveratrol.
You bet. I am a huge fan of all of that. But now, most people don't get it in their diet. That was fun. That was a good little segue right there. Yeah. Well, my all-time favorite, and you probably don't know this one. This is from Metagenesis. We private label this one, but this is Ultra Curcumin Plus. Holy cow. It is the highest form of curcumin, frankincense, boswellia, xanthol, humol, green tea, ginger.
Yeah, ginger's really
ginger. I mean, it is unbelievable for inflammation. This combination is with CBD. I can't tell you how many pain patients I've helped with that who just under chronic pain. Now, again, there's not enough CBD or curcumin in the world to fix a bad diet, right?
Right.
Or not sleeping at night, or not taking care of yourself. But this combination right here, I had a guy, you didn't know this because I hadn't told you this, but he's not a patient of mine. He came in the office, he broke like 17 bones.
Wow.
Legs, pelvis, hips, broke it all in a car crash not too many years ago. I wanted to take him upstairs and put him on the biomat that we have, right? Well, he couldn't get up the stairs because he has a cane. So I didn't know what to do, and he had seen us online or something, and I said, well, and he and his wife were in there, and I talked to him about his diet. But anyway, I started him on just these two things because I said, I only know two things that could really bring it down if you clean your gut up as well. His wife came back in last week, or 2 weeks ago, I don't know, it was 2 weeks ago. She had an empty bottle of this and this. She said, I'm telling you, it's unbelievable. Out of all of his pain meds and all, this combo works better. She said, he came to me and he said, go get me some more of this because it works. Turmeric, curcumin, but you don't use CBD in your office, but I'm telling you, it works. The research on it as an anti-inflammatory and a neuroprotectant and an antioxidant is huge. Well, yeah, I mean, the government holds the patent for it, by the way. So it is extremely, it works beautifully for inflammation. But anyway, yeah, so I'm a big fan of, you can't fix all this other stuff without fixing the diet and getting the curcumin in. And sometimes you need some supplements. Fish oil is a big deal for inflammation. And I use a lot of fish oil.
Omega-3s are great.
Omega-3s are great for inflammation. Yep. Okay, what else?
Yeah, so you're looking at all those things. So we talked about hormones. We talked about diet.
Actually, we didn't talk a lot about hormones.
Yeah.
I'm a believer that your hormones need to be optimal, right?
Yes.
Testosterone is important in men and women.
Correct.
At physiological levels, not super physiological levels. But I know that my pain level is lower when my testosterone level is where it should be. Correct. And for women, they don't believe we should have any hormones, right?
You definitely should.
I know that. And estrogen, ladies, has about 400 functions in your body. Keeping your brain sharp is one of them, but keeping your bones strong is a huge one. Women who get osteoporosis, generally as a rule, it's skinny white women, right? Because we don't have any fat. Estrogen hides in fat, right? So the skinny white women don't have any estrogen in their bones. It's fascinating. And it's sad. And they don't think that any woman needs estrogen. Yeah. And I do think, now you have to be careful because if you have breast cancer, things like that. There are all things, I don't want emails about this, but keeping your hormones physiologically level, I think is important.
Yeah, it helps you recover. Help the muscle pain, the joint pain. actually helps those things go away.
Mm-hmm.
So when those are out of balance, you'll have those pains.
You will, those aches, those pains, those creaks. Yep.
And you don't recover well.
And that's a big deal.
And so, recovery is huge. So yeah, so hormone optimization is I mean, it's one of those things. If it's one of those things, if we don't do that, and we're once again going to try to treat your musculoskeletal issues, then we're once again doing you a disservice by not paying attention to that.
I'm glad to hear you say that.
Yeah.
It's important. It is.
Very, very important.
Okay, what else?
Yeah, so so we've talked about those things, and then just a lot of questions people have is like, one, does this work? Is the research out there? And as I've been doing this over the last 4 years, I mean, it's something that has really changed my practice to the point that I try not, I do less surgery and more of this, right?
Yes.
Surgery is one of those things that I may make you better, I may make you worse, but I'll make you different every single time.
Ooh.
And so we don't,
That's almost like you're talking people out of surgery, though, the way you say that. That's interesting. But I guess you are different every time.
Every time.
Wow, I hadn't thought of it like that.
And if we can handle things with a regenerative procedure, we get you where you want to go.
Yes.
Then that's great, because there's little downside to it.
Right. I mean, it costs some money, and that's part of it. Time and money. I mean, this stuff is not cheap, and that's what I tell. But so here's the thing: if you're going to spend that much money to have some PRP or some stem cells put in you, then you better do what your doctor asks you to do, right?
Right.
Like clean your diet up, change the way you're moving, or whatever. I don't know what you would ask them to do, or I don't even know. Is there any downtime to it? Like if you're going to do my knees,
right? So
is there any downtime?
So if we were to do your knee, you're going to have about a week where you're going to have some swelling inflammation, because we're going to get an inflammatory response.
Yes, which is good.
Which is what we want, right?
Okay, that's exactly what you want.
And then by 2 weeks, you're probably back at baseline. And then a month out, you may feel 10 to 15% better. Sometimes people are a little more, a little quicker, but usually they're kind of 10 to 15% better.
Okay.
And so 2 weeks after we start a little physical therapy,
okay.
So you're back to doing life. But we kind of ask you to kind of take it easy for that particular body part.
Okay.
We do some therapy
okay.
For about 6 weeks, and then 8 weeks after the procedure, we cut you loose. We say go back to doing the things that you want to do, that you love to do, but kind of do it, kind of ease back into things, and then kind of as time goes. And so most people by 3 months, especially for something like a knee, they go, gosh, I'm feeling 60 to 70% better. And these things will work for 6 months to a
okay,
year.
that's what I was getting ready to say. Does it progressively get better if they take care of it and do what they're supposed to do? Okay.
6 months to a year to work, and like I said, and then it will last for an average of 3 to 4 years. And like I said, some people.
Well, I'm telling you, if you can buy yourself 3 to 4 years, that's a big deal.
That's huge.
Yeah, it's huge. And it's like what I tell patients in the office. I'm like, it took you 45 years to get into this shape for sitting on my couch. 45 years. Because they'll say, how quick is it going to work? And I'm like, well, hang on. It took you 45 years to get in this shape. It's going to take you longer than 4 weeks to get out of this.
Right.
You're going to feel better in a few weeks. I mean, really and truly, after a couple of, a week or so of cutting out these inflammatory foods, you're going to feel better. But it's going to be 3 months, 6 months, 9 months. You're going to look back and you're going to be on this couch with me in my office, and you're going to say, holy cow, Dani. I feel way better than I used to. I'm not where I need to be, but I'm so much better than I was, and it's progressive if you keep going. But this is a marathon.
Yeah.
It's not a sprint. And again, those knees didn't just happen yesterday, unless you had a traumatic injury. I mean, if you had a car crash or something, I mean, that's completely different. But as a rule, these things don't just pop up.
Yeah, they don't.
It takes decades, many times, to tear them down, just like it does your health.
Yeah. And
what we have to do.
Yeah, and I'm going to just talk a little bit about, we'll take a knee, for example, because, knee arthroscopy is one of the most popular surgeries that we do as orthopedic surgeons. And I've definitely looked at things, I look at things a lot different now. So I used to think, well, gosh, you've got a little meniscal tear in there. Well, we're going to go in there, we're going to shave that meniscus out. But actually, when we do that, we're making that joint, the stresses are going to now be different. We're actually going to cause more stress in that joint. And when you have more stress, we're actually going to cause more arthritis.
Oh.
And so I like to leave all, everything that God gave you, I like to leave in there.
Yeah, I like to.
And then, once again, try to treat with something like a regenerative procedure to try to help those things. Because although we believe at times when the structure is off, then that causes pain. But sometimes it's not about just the structure. Sometimes it's about what's inside that joint. I see people all the time. They've got, a horrible looking X-ray. But they have no pain whatsoever.
Right.
I see someone that has a not so horrible looking X-ray and they have all the pain. And so it has to do with that. The things that cause the inflammation, it goes back to those things.
Yes.
And so if we can once again make that inflammation better, we can make that joint pain better. And so, we'll get an MRI and they're like, oh, you got a meniscus here, and let's operate on you. Like, well, that may not be the best thing to do. Like, let's try to do therapy. Let's try to potentially do a regenerative procedure. Let's clean the diet up and see if we can make those things. And there's plenty of research that will validate things that I'm saying.
You bet. There's tons of research. Inflammation, there needs to be a whole semester taught in med school, nurse practitioner school, PA school, wherever you are, on just inflammation. Because I'm telling you, inflammation is the devil. It is straight up the devil. I did a little course. It's on our website. It's called Inflammation is the Devil. And it's true. It's the root cause of pretty much, I would dare say, most all chronic disease, inflammation.
Cardiovascular
You bet.
issues.
The number one reason, the American Heart Association says the number one reason for heart attack, stroke, high blood pressure, high cholesterol is inflammation from sugar intake. Yeah. Sugar.
Yeah. It's tough.
Yeah. So anyway, when you cool down the inflammation, you cool down so much. Shelby had asked on here, and Shelby, I saw your question, but I can't see everybody else's because I'm not going to stand up there on this. She said, which hormones specifically would help with aches and pains? And that's different. And Shelby's young. She's 24 years old. So I know. Testosterone for sure, I think, helps with aches and pains, and probably estrogen as well. Progesterone is more of your calming hormone. DHEA, possibly.
Yeah.
So what do you know about DHEA?
So, DHEA is the hormone that's right before testosterone.
You bet.
So if those things are low, you're not going to make those things. And
bingo.
So that's why you want to really optimize that.
That's right.
So it's very, it's just, if I know at the age of 42, when hormones weren't optimized, it's like I'm falling off a cliff. And so when you optimize those things, it's like you're here instead of doing this.
That's right.
And so looking at all those things and saying, okay, well, what do we need to? How do we need to? And replacing testosterone is tough. Not necessarily in women, right? But in guys, we really want to think about that. But as far as for you guys, giving you a little testosterone is great. Depending on where a guy is, as far as how old they are, they're going to have more children and all these things we have to think about.
Well, yeah, you got to be careful though. You got to be careful with hormones, period. People who these hormone clinics that just crank out hormones like cattle in there, I'm telling you, I end up having to fix a whole lot of issues in the office, from women's hair falling out to men's testicles shrinking up to. But the beauty of that one is you stop the testosterone, generally the testicular volume comes back. But it's just one big mess. And the hair falls out. The hair doesn't come back when you lose it from a testosterone problem. Yeah, it's so anyway, estrogen, progesterone, testosterone, DHEA, all those hormones, Shelby, help. They all need to be optimal, and that's when you need to have a provider who's checking all of those, right? Not just one thing. You need the whole panel done. And vitamin D is important. Vitamin D is important for your bones, right?
Completely.
Yeah.
And I would say that probably 95% of people are low in vitamin D.
You bet they are, and especially the darker the skin, right? So your Indians, your Hispanics, your African Americans, they have no vitamin D.
Yeah, I checked my level about 2 years ago.
2 years ago?
What?
You need to
It was 16 at the time. We've addressed
That's a vitamin D deficiency, by the way.
we-
16, full-blown diagnosis on his medical record. Vitamin D deficiency.
we addressed those things.
So what are the symptoms of low vitamin D? Heart attack, stroke, cancer, osteoporosis, osteopenia, fatigue, depression, foggy headedness. I may have said insomnia. I mean, there's like 28 or 30 things they've identified, that low vitamin D can contribute to. And those are about 10 of them right there. So it's important to keep your vitamin D level optimal. Good Lord.
Yeah.
16?
So I was taking like 10,000 units.
Yeah, for a while. Okay. So now, I know somebody asked on here, do you take anything like, shrinking testicles is never a good thing. No, it's not, Mary Chabinko. It's not good. And I had a guy come to me anyway. He was like, oh, Dani. And I already told him, this is the side effect. Your testicles may shrink. And if you want babies, number one, you don't want to be on testosterone. And oh my Lord, he came in, he said, Dani, anyway, it was funny. I mean, what he said. And I said, well, let's stop it and let's see. And sure enough, they came back and he was all happy again. But he wanted to show me and I said, it's fine. I believe you. They're tiny. We'll get them back to where they belong. Sure. But listen, okay, what was I going to say? Oh, somebody had asked, do you take, now I don't know if you do or not. I know you take insurance for your visit, but there's something called care credit. Do you do that with your regenerative services?
So we have a similar product to that.
Okay. Yep. Okay. So something like care credit to where they don't have to pay it right up front. Correct. Or I don't know how that works. I don't take that in my office because we don't do procedures like this in there. But that's important to know. You need to share that.
Yeah. So we have something very similar to care credit, and they do a very good job. I think it's like 6 months, no interest kind of deal. So
okay,
you can make those things where you can get your health back.
Okay, good. I'm thrilled. Do you have anything else that you want to talk about tonight? I'm just so wanted to promote this guy because I had heard so much about him for a year, and we both were busy, and I reached out to him, and he goes,
"You're on the list."
Yeah, I was on the list. A lot of good that does. You're on the list. Yeah, I'm on but I reached out. He was on my list, and I reached out to you. Remember, I sent you an email on Facebook and said, hey, I've heard amazing things about you. I think we'd be great, complimentary, what I do, what he does kind of thing. And I just wanted you guys to learn about him because it's very rare to find a surgeon, number one. Surgeons are great people. They're fabulous. I know a lot of surgeons. But it's very rare to find a surgeon who would talk you out of surgery because there's a reason they're surgeons.
Yeah.
They love to cut. I mean, there's...
And surgeries, I love operating. I love rotator cuffs. I love ACLs. Those are my favorite surgeries. But there's other ways to get to that, and there's ways that you can do things and help people, and they're not, you don't have to cut on them.
Well, the beauty of it is, the body is designed to heal itself.
Yes.
It's designed to heal itself. Now, does it always? Not always. But it's designed to heal itself, but you have to give it what it needs. Correct. Right? And when you give it what it needs, which could be diet or extra sleep or, moving your body properly, stem cells, PRP, what have you, and if it does that and takes over, how beautiful is that? Then you're doing exactly what you were designed to do, right? Yeah. If not, what's the worst case scenario? Well, you have to have surgery, right? By a competent surgeon. I mean, but good Lord, what do you have to lose? Nothing.
Yeah, there's very, very little downsides to doing doing regenerative procedures for musculoskeletal issues. Very little. Okay.
All right. Anything else? Okay. What's your website? What's your phone number? And I'll put this up there as well. But you guys write this down. What's your?
Yeah. So website is NashvilleRegenerative.com. Phone number is 615-850-4415. Again, that's 615-850-4415.
Okay.
We're located in Franklin, Tennessee.
Yeah, just right over here. Literally not even a mile from my house. It's ridiculous there. Cool. What's it called?
Aspen Medical.
Aspen Medical Plaza. Yeah. That's right. Right at the very end of Mac Hatcher and Cool Springs Boulevard. Right?
Yeah.
Yeah, he's got a great office. I went in there and checked it out. It's great. It's a big office. Yeah, it's wonderful. If I ever need an orthopedic surgeon, I hope to goodness I don't, I'll give you a buzz.
Thank you.
How's that?
That'd be great.
All right. I'm all about that PRP stuff and that stem cell. I think it's fascinating. So you guys, okay, next Sunday night, we are not having Sunday night service. But guess what? The next week is February the 10th. guess who's going to be our guest? I'm so excited. You probably don't know who this is, but Angela Roberts. She's the Spinach Tiger. Spinach Tiger. Oh, she's awesome. She has an amazing website, spinachtiger.com. She's not a chef. She's actually like a psychologist. And she's going to talk about, but she has all these gluten-free recipes. Oh my Lord, she's amazing. So she's got a fabulous blog, but she's going to talk about what it's like to be in your 60s, and living life to the fullest potential. She's going to talk about exercise and diet and sleep and friends and the things she works out. She just looks amazing. So she's going to talk about how she combines it all in her 60s. So this is going to be a ton of fun. She's a character.
Yeah, that's going to be great.
She's Italian, so she's a fireball. And then the next Sunday, February 17th, Dr. Motley's going to be back, and we haven't decided yet what we're going to talk about, but he'll be back from office stuff, so that's exciting. February the 2nd. You guys that watched did you see any of our electromagnetic field services? Probably not.
I didn't.
No, I didn't think so. But if you get a chance to, they're very good. February the 2nd at the office, you can sign up online at DaniWilliamson.com under events. We're having a 2-hour presentation on a workshop on how to make your bedroom a sanctuary. And it's fascinating. The electrical engineer, Vicki Warren's coming in, her partner in Wings of Eagles, Healthy Living, Janetta Hitt's coming in, and they're teaching you how to go through your home and find out where your electromagnetic fields are one-on-one. I mean, so it's limited to 15 people. You can sign up online. It costs $10, but we're just, giving that to them to cover them coming in because they live quite a bit far away. February the 2nd, sign up. I want her to have it sold out. It's only 15 people, okay? All right. September the 12th. Oh, you need to save the date for this. You don't know about this. September the 12th is my 5-year anniversary at the office. We're doing we're going to do it on September 12th, 5-year anniversary, and we're doing a huge fundraiser. Mary, I'm going to need you to set a table up there, by the way. We're doing a fundraiser for Music and Memory, which donates iPods to patients with dementia and Alzheimer's, and with their favorite playlist on it, because the music part of the brain, music memory part of the brain, is the last part of the brain to go in Alzheimer's. So when you put your favorite tunes from the 40s or 50s or whenever it is that your playlist is, those people come back to life. Yeah. Now, it doesn't take away the Alzheimer's or the dementia, but they really have a shortage of iPods that they need so we're raising money, silent auction, fundraiser, all this. The Dotted Line is catering our 5-year anniversary. It's going to be a big deal. Tents and tables and booths and vendors are coming in. September 12th, I want you there.
I'll be there.
Okay, it's going to be great, and we're going to be raising tons of money. All right, guys. We appreciate you. We love you. Thank you guys so much, and I will answer your questions somehow, either on my phone or there, and Dr. Kellum will as well. But I don't know what happened. If anybody else is having problems with their Facebook page, let me know, because I certainly am. All right. Anything else you want to say, Dr. Kellum? I'm so glad you're here, sharing what you love. Yeah. He loves what he does, and I'm telling you, people love this man. The couple of times that I've been out with him at Whole Foods or what have you, everybody comes up, Dr. Kellum, Dr. Kellum.
It's fun. I enjoy it. It's a lot of fun.
I know you love it, and I'm glad you're here. So, all right, guys, we appreciate you, love you. We'll answer the questions. We'll see you tomorrow. Have a great week, all right? It's going to be a fabulous week. It's the last week of January. I'm going to see Cher Thursday night. Ooh, she's 70. I wish she's 74 years old, and she's in the best shape she's ever been in her life.
That's what I want to get to.
She's probably having stem cells for all I know. She's having something. She's got some silicone in there somewhere, man. She's pumped up. All right, guys, we love you. Mary, I hope you're doing okay. I've been praying for you guys. We'll see you later. Happy Sunday night.